This is an introductory video to the series of instructional videos, educational videos for proprioceptive neuromuscular facilitation, diagonal patterns of arms and legs, or upper extremities and lower extremities, known as PNF for short. Why do these movements and these exercises? There are many reasons and many benefits to using these patterns in your activities. Use them as an adjunct or a support to therapies that you're already doing, or exercises you're already doing, or movements that you're already doing. They can be used to enhance those things. PNF is derived from people who watched human movement and how we move when we're moving most optimally. And these patterns are very basic. They're not the only ones out there, but they are a really nice foundation to help you learn things about yourself and improve things about yourself and optimize things about yourself as you're going through your life. If you want to try to improve your flexibility or your range of motion or your tissue pliability, the way your nerves are gliding through your muscles and the way your muscles are moving as you move, your connective tissue moving as you move. Maybe trying to increase range of motion in a shoulder or an elbow or a knee or an ankle. They can be used in these ways. They might be used to help improve things like coordination and balance. They're wonderful to help increase flexibility, as we've talked about, and to strengthen as well. You can use them very specifically if you are training for a sport, or perhaps you are just training to garden. You might be focusing on a shoulder, or you might be focusing on a whole region, your whole body. They're wonderful for all of the above because they are based on our natural movements, and our bodies function as a unit when we work. You can do these when you're sitting, and you can do them when you're standing. Doing them while you're standing is a great way to practice your balance and coordination. But if you're unable to stand, or if you're unable to stand safely, please do feel free to do these sitting. Pay attention to your breath. Pay attention to any symptoms that you have. If you have increasing pain or increasing things like numbness or tingling as you're doing these, stop and check with your healthcare provider to find out what that might be and how that might be adapted for you. Also, pay attention while you're moving to what happens with your body in terms of the weight shifting. As you're moving in one direction with an arm, feel how it changes what happens in your feet or in your seat. And what we want to do sometimes is play with that. Try to keep the weight even as you're moving for more stability in our body, or maybe allow that weight shift to happen in our seat or in our feet. But we always want to stay anchored. Don't forget to stay anchored. As you're moving an arm or a leg in one direction, remember what the rest of your body is doing and have it anchor you in the opposite direction. We haven't given you every single tip here, just some general cues for movement. So please use these in conjunction with other therapies and other therapists, other trainers, other educators, other movement professionals to help enhance your experience. And I hope that these are useful. If you have any questions, don't hesitate to reach out to me. I'd be happy to help.